Good afternoon and welcome to a webinar on employee safety, on FSMA, tomorrow is employee safety, on practical measures for implementing FSMA in your food manufacturing facility. A webinar hosted by EAS Consulting Group and presented by EAS Independent Consultant Julie Litz and Senior Director Alan Sayler. EAS, a member of the certified family of companies, is a leader in regulatory solutions for industries regulated by FDA. Our global network of over 150 independent advisors and consultants enables EAS to provide comprehensive consulting, training, and auditing services, ensuring proactive regulatory compliance. From regulatory strategy development, compliance with FSMA assessments, including supply chain, quality agreements, support for and receipt of FDA Form 483s, warning letter remediation, EAS offers the detailed knowledge and experience your company requires to ensure accurate and timely assistance. Today's presenters are Julie Litz and Alan Sayler. Julie consults with EAS clients on matters pertaining to food safety, including FSMA, PCQI, HACCP, as well as others. She assists with preparing standard operating procedures, conducts investigations and root cause analysis, and develops audit plans. Alan is a Senior Director for Food Consulting Services with expertise in the areas of food processing and food packaging, as well as GSFI third-party certification programs such as Safe Quality Foods. Alan represents the U.S. food processing industry at Codex committees on food additives, food labeling, food hygiene, and milk products. As a reminder, during the webinar, you may ask any questions by typing them into the questions box. And with that, I'll turn the presentation over to Julie.
Good afternoon. This is Alan Sayler. I'm going to go ahead and start. So, Julie, please forgive me if I'm starting ahead of you.
Sorry about that.
Not a problem. Thank you, Amy. That was great. And yes, to note, and Amy did a great job, is that we cover a wide range of services, not only food, but pharmaceutical, dietary supplements, infant formula. We have enough consultants where we actually have teams with various levels with all kinds of expertise, biologics, cosmetics, tobacco, just a wide variety. And our model is quite different from most consulting companies in that we rely primarily on our consultants. The nice thing is you've got this access to a huge platform of expertise, and you only pay for what you need. We don't have a large staff that you end up paying for if you don't need their services. So with that, I would like to move to the slide, and there are a couple of introductory slides that are not that important, but I'd like to move to the slide on general information, because I think that is where we want to start. So my job is to lay the groundwork for Julie then to go into the practical aspects of what do you do in this era if you are a food plant manager, if you are a supervisor, or if you just work at a food processing plant. So what do we know? And I think most of us have seen so much information, whether we see it at night when we get home, or if you're homebound, you see it during the day from time to time. There's a couple of things I want to set the stage for so that we all have the same understanding. First of all, this COVID-19 is highly contagious. It is more contagious than the average flu that we see come by every year. However, it doesn't seem to be quite as contagious as measles, but in any case, it is highly contagious. It seems to have come from bats, not that it makes that much difference today. It jumped, and it didn't jump directly to humans from bats. It seemed to have jumped to some other animal, possibly a cat, and then to humans. We don't know. One of the things they do find interesting, and this is from webinars I've been on with CDC, NIH, and others in the past week, where this seemed to have originated, almost all tested positive for the COVID virus. So one of the things we know is that cats can get the virus, and they can infect humans with the virus. So that may or may not have any applicability to the food industry, but it is probably important for us on a personal basis. What about the incubation period? Some people have almost no symptoms and seem to come down with severe symptoms within days. The length of time for an incubation where some symptoms are showing seems to be limited to around 14 days. That's why they put a 14-day quarantine if somebody has symptoms, to self-quarantine or to quarantine. and at the end of the 14 days, you don't have any other severe symptoms. This is a pulmonary virus. There are some anecdotal evidence that some people do have intestinal or digestive upsets, and these people seem to have a much more severe case of the pulmonary as well, but in most cases, for those that get it, it is a pulmonary. Let's move to the next slide. And what is interesting is yesterday, this is the data, and the numbers change every day. So obviously it's not quite accurate, but I did want to point a couple of things out because I did compare today's numbers against these on the slide. The United States, we went up 40,000 cases in one day. We went up 2,000 deaths in one day. If you would plot this for those of us that have had to take statistics or data analysis, we are in it seems like an almost vertical curve right now of increases. We are hoping we are at or near the peak. Every state in the United States has different times until we hit the peak or get past the peak. And there are some modeling information on this on the website that you can get, or I can provide access to, or Amy can if you're interested. The death rate in the US is about 3.2%. The death rate in Spain is 10%, and Italy is 12%. Whatever the death rate is, it's a tragedy, and we all have to do our part. We are all probably starting to get cabin fever fatigue. If you don't have to go to work, you have to work from home. But right now, that's the safest place. Let's move to the next slide. Okay, so person-to-person spread. We know this is the primary, not the only, but almost the primary way that people become infected. It's the 6-foot distance that we've been told by authorities, and I certainly respect that advice. So social distancing of 6%. I have heard that there are retail stores where there are X's up and down their aisles, and those X's mean if anybody gets between the X's, if more than one person gets between the X's, they're actually almost like in an elementary school told to separate themselves because the 6-foot distance is so important. One of the primary ways obviously is through sneezing, coughing, or talking where we don't even know it, but we expel when we're talking, small droplets, and those droplets, if there's moisture and you're infected, those droplets have a virus in them, and they float in the air. How long? It depends on the size of the droplets. Could they float more than 6 feet? I suppose it's possible, but 6 feet seems to be the best distance. Now, the other thing is, just because people are not showing symptoms, that means we can get closer than 6 feet, right? If we're out in the public and we have to do grocery shopping, get prescriptions filled, or other necessary activities. The answer is, there are people that are carriers and can shed the virus without even showing symptoms. So I don't want to create a panic here, but the 6-foot distance is probably good for anybody other than where you're in a family situation. Hand hygiene, very important. Most of us that have lived in the public health world of our careers about hand hygiene or hand washing and the 20-second rule, or singing Old Lang Syne or something else like that to make the 20 seconds effective. Key is you wash your hands and scrub them, clean the nails, dry them, and then use some type of an alcohol-based sanitizer. Face masks. It is interesting that just recently we had a change from face masks might be okay to actually Los Angeles has just issued a mandatory face mask for anybody going out in public. And I think that is a very wise situation, particularly if you're in a food plant where 6 feet is not practical. So let's move to the next slide. Okay, this is about surface spread. Now, we had mentioned that cats, now we don't have cats or other animals in our food plants, at least not to my knowledge, so that's not an issue, but what about surfaces? Well, one of the things we know about surfaces is that if there is a surface that is stainless steel or plastic, this is laboratory conditions, not real world factory conditions. They have been able to recover viruses. They don't know if they're infectious, but they could recover viral material up to 3 days after they were the virus was put on these surfaces, and up to 1 day on cardboard. Now, with that being said, I want to assure you that right now there's no evidence that food or food contact packaging has resulted in an infection, and that's very important. What about how can we, and Julie's going to cover this in more detail, so I'm going to cover it very quickly. What do we know about cleaning surfaces and sanitizing them? It seems like chlorine and alcohol-based compounds are very effective. Ammonia, which sometimes is more readily available simply because these other compounds are sometimes in short supply, is not as effective. In fact, I was on a webinar where they suggested that ammonia might be good as a cleaner, but as a sanitizer is very ineffective with the virus. Next slide. Okay, these are some CDC web shots, and I'm not going to go into a lot of detail. Basic things. Train employees to avoid touching their eyes, nose, or mouth. And I've heard it said, don't even touch your face. Now that can be easily said, hard to do. As creatures of habit, we sometimes do that. The next slide is, there's some things that it's interesting that people that are not in the public health or food safety area or in the medical profession really don't have a sense of what this virus has, what its cause, what its origin. So first of all, there are not certain types of ethnicities that are resistant or have a lower infectious rate. I've not seen any data to show that, so we all are at risk. The second thing is that number 2 here says that the immediate risk is low. And I think that's probably true. 3% of the population is not very high. I don't know the numbers, I should have checked, but what is the number of deaths because of car accidents per year per population? I don't know the number, but I suspect it is maybe around that, maybe a little less than that. But in any case, that seems to be acceptable. I would simply say this virus, whatever the percentage of deaths versus recoveries, is scary to people. And you have to understand it when you're talking with employees that they may be cool and calm, but they are really concerned for themselves and their families. And it's really our responsibility to make sure that their information is factual. There are other things here. I'm going to move on. You can certainly look at these slides. They'll be available, posted on the EAS website sometime after this. A couple more slides, and I want to turn it over. We are essential. That's good and that's bad. Essential means that we are probably getting paid either at home or we're having to go in. The difficulty is the risk may be slightly elevated, not because of age, not because of prior medical conditions, but just because our likelihood of exposing ourselves to others within a 6 foot or less distance is higher. Finally, we have to understand that staff have families, and we all do. And so if you're a supervisor or manager and your obligation is to keep the production going because it's an essential, food is an essential part of the U.S. economy, and certainly in this era where we don't need to raise concerns in the public because maybe food is becoming short available, which is not. But please have that sensitivity. The other thing is, I guess if I was in a food processing plant where I was like this picture, standing next to other fellow employees, I'd want to know if somebody had symptoms, had reported that they might have been exposed, or that they were exposed and they didn't show up the next day, and all of a sudden they put somebody else next to me. There is a challenge because the HIPAA laws and regulations do not require, although it's strongly encouraged, do not require people to report. Now, in some cases, that's been changed at the local or state level, but generally from the federal level, that has not changed. So the best thing you can do is, if you cannot separate workers by 6 feet or more, then start thinking seriously about personal protective equipment. I know that for PPEs, Julie will talk about that. And to wrap up, really important to educate and talk about it versus ignoring it. In the absence of information, people tend to make things up or formed. Make sure you have clear policies about PPEs. That isn't something that we set up a year ago and we're just going to dust that old policy off. This is a different era today, and the need for personal protective equipment and who should wear it and what kinds of personal protective equipment that should be worn is very different today than it was pre-COVID. You should encourage your employees that if they have any of the typical symptoms of cough, sneezing, tightness, difficult to breathe, particularly if they have underlying medical conditions, then they should consider staying home, and then if it continues to get tested. Finally, I would encourage you that CDC has an interim guidance for business and employees to plan and respond to COVID disease 2019. That's being updated continuously. I would use that and look at that, if not daily, at least once a week, to see if there's things that I could do to improve the way my food operations are managing the COVID preventive controls, if you will. So with that, Julie, would you like to take over, please?
Yes, thank you very much, Alan. So I'm going to start today with talking a little bit about some of the employer obligations. During this time, you need to remember that there are laws protecting your employees against discrimination. You cannot require that COVID-19 high-risk individuals stay home under the American with Disabilities Act unless you have a directive from a CDC or another authority that says that that employee should stay home. Other than that, you should make sure that all of your employees understand that there are people out there, such as older adults and people with chronic medical conditions, that may be at a higher risk for severe illness. All employees should be treated equally, and any medical information that you have on any employee must remain confidential. To help reduce the risk of the spread of the virus, supply all necessary PPE, as Alan was talking about, and make sure that with this PPE, the employee is instructed on how and when to use the PPE. Next slide. There are some steps that you can take to reduce the risk of spreading the virus. These include increasing your routine cleanings. You want to pay particular attention to high traffic areas, any high touch areas, your doorknobs, countertops, light switches, any common areas where people might congregate. You want to make sure that your employees are protected with that social distancing that we all hear about, that staying at least 6 feet apart. As Alan was saying, in many of our retail locations, you can see those marks. We need to make sure that our employees have that at their place of work also, if they're required to be there. Increase remote work capabilities. If you have some employees that are able to work from home, let them do so if it doesn't require that they be at the facility. This reduces the number of people that are entering your facility and possibly reduce the amount of exposure to other employees that are there. You may consider modifying your visitor and contractor policies. You may want to make your plant open only to essential personnel or essential contractors that are necessary to come on site. Please let employees know if they are showing any symptoms, flu-like symptoms, COVID-19 symptoms. They should stay at home so that they do not risk exposing others to the illness. They can call their physician and see if they need to get tested, but while they're showing symptoms, they need to stay at home. We all are guilty of coming into work when we have colds. We need to be very careful during this time that we encourage our employees to stay home if they're sick. Also, if you have any temporary employees that are sent to your plant by staffing agencies, make sure that they do the same with their employees before sending them to your site. Make sure that they screen them for any potential symptoms, and make sure that those staff are well aware that they shouldn't come into your facility if they're showing any symptoms. Next slide. The CDC says that maintaining routine cleaning practices that are currently in place are adequate. However, during this time, you may want to increase the frequency of cleaning. So you can use the same cleaning practices, maybe just do it more often. You also may want to limit the traffic to certain areas in your plant in order to reduce the potential spread. You may want to, as I said previously, limit the access to your facility, again, to only critical personnel and critical service contractors that are necessary to come in. Next slide. This is a great time review hand washing and hand sanitation practices with all employees. You need to make sure that hand sanitizer is readily available and at more locations to encourage more frequent use. If you cannot find hand sanitizer, which is a hot commodity right now, you can make your own. There's many recipes available on the internet. At my current location where I work, we have a lab on site. We got the lab at 2-propanol and diluted it to 70% with water to make a 70% isopropanol solution. This is what is commonly found in hand sanitizers. So we put this solution into squirt bottles and then put the squirt bottles located at every entrance to our facility and at all interior doors inside our facility. Then all personnel were trained that upon entering the facility, they were to pick up a disposable towel that was also provided at each station, wet it with the alcohol, and use the towel to sanitize their hands. They were then instructed to keep that towel and use it on every surface that they touched, doorknobs, light switches, countertops, as they made their way to their workstations. The employees were instructed to follow this same procedure as they moved throughout the facility throughout the entire day. This gave us more frequent hand sanitation and also more sanitation of all surfaces throughout our facility. Next slide. In this challenging time of the COVID-19 pandemic, we have to remember that we are obligated to maintain food safety in our food production plants and adhere to FSMA policies that have been set forth by the FDA. There are some of the challenges that you may be facing include interruption in availability of trained personnel. Many of the plants may be reducing workforce, or workforce reduction may be occurring due to illness or due to family obligations during this time of crisis. Interruption of established services. Many of your contracted services are experiencing the same thing. They may have interruptions in their ability to perform the service due to workforce reduction. Interruption in supply materials, including critical cleaning products. Your supply chain may be disrupted, may not be able to get critical supplies. For example, as we already talked about, hand sanitizer. Foreign supplier verification. This virus is pandemic, reaching many countries worldwide. So if you get supplies from a company outside the United States, how do you maintain your foreign supplier verification program during this crisis? Next slide. So I'm going to start with interruption in available trained personnel. The workforce in many plants has been reduced, and sometimes this reduction may remove trained personnel. This critical time may require that you shift personnel to different areas and may require additional training. In order to maintain your food safety plan, your personnel must be trained in how to perform the current job that they are doing. So you need to be prepared to offer additional training and additional supervision for your employees as it is needed. Be sure your current policies that you have in place reflect exactly what is being done in your plant. If things change due to the circumstances, you need to update your policies with COVID-19 addendums. That will then be in place until the situation returns to the normal production operation. You need to make sure that any change in policy that you put in place meets the CFR 117 cGMP requirements. Check your workforce. You may have people that were moved to different positions within your operation, and they may be available as an already trained individual for a critical task. You may be able to pull them back temporarily until you can get someone else trained to perform that critical task, therefore not having to shut down that particular area. What if one of the personnel missing is your PCQI? You can get creative with this. You may be able to have the PCQI come in after hours if you operate on only one shift and if the person is not quarantined for COVID-19. You can utilize streaming services, Skype, FaceTime. If it is critical that the personnel see something and there's a question about it, they need to see what is happening, they can do it on a virtual basis. If someone is required to conduct document review, your PCQI needs to do document review, but they're not physically present, you can have a supervisor that is present sign or initial the document, send it electronically to the PCQI to review. The PCQI conduct the review, sign it, and send it back electronically. Then the electronic copy can be attached to the original, and it can be noted that it was signed off-site due to COVID-19 restrictions. During this time, it's critical that you must maintain cleaning and sanitation practices. If your workforce is reduced to the point that there are not enough personnel available, you may be forced to temporarily suspend a line if you have more than one production line in place. Or if you have only one production line, you may have to reduce the amount of time the line runs in order to train the production personnel to perform the cleaning and sanitation. Remember that if you are training someone to do this, they must be properly trained and supervised and must be able to prove they can perform the duties. And remember, this training may take a few days to accomplish. This may not be something that can happen immediately. Proof of training and proof that the cleaning is meeting the requirements must be recorded. Next slide. So if you do implement your food facility policy to limit access to only staff and critical personnel, this may cause a problem with service people that need to come in and perform critical services for you. Examples, pest control, cleaning and sanitation services if you hire somebody off-site to do those, laboratory services, maintenance and repair contractors, and many others. So in this case, what you need to do is check with your contractor. The contractor may have policies in place for entrants that would allow them to come into your facility. For example, pest control. They may be sending their employees to only one facility per day to reduce exposure to the employee in the facility. So they haven't been anywhere else. They're coming from their house to your facility. Some of your contractors may be providing additional outer garments, Tyvek suits, gloves, shoe covers that they can put on prior to entering the facility, or you may want to provide those to anyone that is essential to come into your facility. For pest control inside your facility, you may consider conducting the inside service while on FaceTime or Skype with a pest control operator that is located outside your plant. They can do a virtual walkthrough, recording everything that they see. The pest control operator can then complete the outside service and submit the report electronically and complete the required service. If you have contracted cleaning and sanitation and they cannot operate because of lack of personnel, then as we said before, you may be able to conduct training of your available personnel to perform these tasks on a temporary basis. An alternative to that is you could seek a different agency, an emergency supplier for the service. If you do seek an emergency supplier, you need to make sure the new contracted service provider meets the requirements set forth in your food safety plan. You need to document the new service provider as an emergency supplier and then follow up after that to do a full supplier verification when the time allows. So all of this holds true for all of your outside contracted services that might get interrupted due to the COVID-19 crisis. Next slide. Many of the challenges that we are all facing are being felt by all manufacturing facilities, whether they manufacture an ingredient or other product that is critical to your operation. This is when you really need to rely on your supply chain program. If you have approved alternative suppliers for critical supply, critical product, you may be able to rely on them during this time. If you do not have any additional approved suppliers for a critical component, you can purchase from another supplier on a temporary basis. CFR 117 does allow this temporary basis purchase in an emergency. If you do this, if it's necessary, you must prove that the emergency supplier's product meets the requirements that are necessary for you to maintain your food safety program. And in order to do this, you may be required to do additional testing of the product that you are receiving. So as previously discussed, one thing that is in short supply is cleaning agents. If you cannot get your normal cleaning agent from your approved supplier, you may be able to purchase a different type of cleaning or sanitizing agent. Next slide, please. The link in this slide can be used to access the EPA disinfectants approved for use against COVID-19. This is a great table. It is a very all-inclusive table, very comprehensive. It also gives recommendations for appropriate levels for use. Just remember, if you switch to another cleaning agent, you'll need to update your policies to include this new cleaning agent. There may be different steps that are needed when switching cleaning agents, so you need to be sure to follow the recommended instructions that come with the new cleaner that you purchase. All personnel conducting the cleaning will need to be adequately trained in the use of the new cleaning protocol, and this training will need to be documented. You need to be sure to include verification activities and testing to assure that no residual contamination remains from the new product that may pose a chemical hazard to the product being manufactured. So just remember, if you do implement a new cleaning protocol and a new cleaner, your food safety plan will need to be updated with the new steps, and preventive control analysis will need to be conducted to identify any possible hazards associated with the new protocol. Next slide. So the FDA is well aware that this COVID-19 presents many challenges for food manufacturers. So they have provided some temporary flexibilities with many of their rules. Temporary flexibility with the egg safety rule. They have extended the comment period for the laboratory accreditation. They have changed some temporary changes to the foreign supplier verification program audits. Temporary flexibility with packaging and labeling of shell eggs, flexibility regarding menu labeling, and flexibility regarding nutrition labeling of certain packaged foods. You can go to the FDA website for details on all of these temporary provisions to the regulations that the FDA is allowing during this time. Next slide. The FDA has set forth a temporary policy on audits. The only audits conducted during this time will be for-cause audits, and any for-cause audits for foreign suppliers will be conducted virtually. Keep in mind, however, that there have been no changes made to the enforcement of food import regulations and recall requirements. Next slide. If your foreign supplier verification program requires an on-site audit as part of your verification activities, and this audit is currently due, the FDA has recognized that during restricted travel times, these audits may not be able to be conducted if the site to be audited is in a restricted area, which, as we know, many areas worldwide are now restricted to travel. Next slide. If this is the case, you may select an alternative verification activity, which may include sampling and testing of the material you are receiving from the foreign supplier. Any alternative verification activity must serve to provide sufficient assurance that the hazard requiring a supply chain control or a hazard being controlled by the foreign supplier has been significantly minimized or prevented during this period that the audit cannot be conducted. The audit should then proceed as soon as it is feasibly possible. You can outline these changes and include a temporary addendum to your foreign supplier verification program that will remain in place during this time and then will be removed once the audit can proceed. Next slide. I want to thank you all for joining us today. I hope that we have given you some ideas that can help mitigate some of the challenges that we are all facing. I'm now going to turn it back over to Amy and Alan for closing comments and any questions.
Great, thank you. And Alan, do you have any wrap-up comments before we get to the questions?
I thought that, Julie, this is great information. I didn't hear all of it prior to you making these comments. I think they're great. One of the things I would just reiterate is during this era where FDA is not doing any on-sites, please understand that these people are sitting at home and they are doing their work. So things, as Julie mentioned, the virtual They're not doing virtual inspections per se, but as far as I know, but they are doing virtual FSVP importer inspections, and we're involved in a number of those. I would also encourage you that if you have any actions or follow-ups based on an FDA inspection where you owe them a response of some kind, I would encourage you not to think that since we're in this era of COVID, nobody's paying attention. FDA staff are definitely paying attention, maybe even more so now, because they are not going into the office, but they are still carrying out their work. So I would encourage you to be ever vigilant regarding your regulatory requirements. And with that, Amy and Julie, thank you.
All right, thank you. Our first question is regarding the receipt of boxes and whether the exterior of the boxes should be sanitized.
I can answer that one, Amy. As Alan mentioned in the beginning of the webinar, there's been no evidence of transmission through any food or food contact that includes boxes. They do say that virus particles can be found on cardboard for up to 24 hours. They have not said whether those virus particles are actually active and infective. Most of the time, the material that we have received has been on a truck or in transit for more than 24 hours. I would say if you're concerned and you think it's been less than 24 hours, you could allow it to sit for that 24-hour period. But at this time, there's nothing that recommends that we actually start sanitizing the outside of cardboard boxes.
Okay, thank you. Regarding the documentation of procedures that are changing, can you discuss whether or how you document those on a temporary basis?
I can discuss how I did it in any area on the documents that were affected. I did in that actual document itself in red bold letter and just said addendum on each step, and I dated it and said, you know, due to COVID-19, and said what the changes were. And then what I will do is then when we go back to the normal one, I will archive that one so I still have record of what was going on during that time and re-implement the original one if no changes are made to that original one.
So Amy, can I ask, or if you have
Sure.
a question, go
Yes.
ahead. I just had one.
No, go ahead.
Okay. Julie, since you are really boots on the ground here, one of the questions I have is, okay, so you have a large food processing facility and people may have multiple access points. They can come, they can go into the lunchroom. Maybe it's only through one door, maybe through multiple doors. Have you done anything to try and reduce people who are interacting at less than 6 feet? Any advice there?
Yes, so at our facility, we actually have put all office or non-boots on the ground essential personnel are working from home. So this has limited the number of people that are currently working at our facility, thus hopefully reducing the chances of transmitting the virus. And also because of that, now at our facility, everyone will be entering through one door. So we don't have a lot of traffic going in and out of different places. And specifically, we do not have a lot of traffic going in and out of the production area, only the production workers, because there really is no one else there. If you're not able to limit it and have more people work from home, I would say that maybe try to have one access point to your facility and have everyone enter and exit through the same area. Also limit as much as possible the traffic to any high-risk areas, to your production areas, to make sure that you're keeping as many people out of there as you possibly can. And again, as I said in my example, we actually have people carrying sanitizing wipes with them along the way so that they can sanitize surfaces as they move through, so we can hopefully not have it transmitted on the fomite objects, the doorknobs, the light switches, and those kind of things.
And while we wait for any last questions, Alan, do you want to discuss briefly the capabilities of certified for food testing in light of FSVP requirements?
Absolutely, I really appreciate that, Amy. Certified laboratories, ES is part of the certified laboratories family, and certified has 3 labs, actually 4. There's 2 in California, there's 1 in Chicago, and there's another in New York. These are relatively new labs from a standpoint of construction, equipment, and capability. What I would suggest is that if you have any laboratory needs related to COVID or other things, environmental monitoring programs, for instance, how do we do environmental monitoring in the era of COVID? Well, I know that Julie has some ideas about that, but at the end of the day, do we need to carry on these food safety programs that are fundamental to demonstrate to our management and to our customers that the product we're making is safe? After all, we can be really good about COVID and make sure our employees don't become ill, and then we can drop the ball on food safety and some of our customers become ill. That's the last thing that we want. So I would encourage you, if you have laboratory needs, we certainly have that capability, and we'd be happy to discuss it in more detail as far as specifics. Thank you, Amy.
Great. Well, I don't see any more questions out there. So Alan, Julie, thank you both so much for the presentation, and thank you for everyone in the audience. We did record today's session, so we will have it posted to the ES website in a few days. And I thank everyone for joining us. Tomorrow's website or webinar is on employee safety, in particular with OSHA requirements. So we invite you, if you're not already registered for that, to join us there. And thanks for your interest in EAS, and thanks for joining us. Have a good day, everyone.
Thank you, Amy.
Thank you.